Well, good afternoon and welcome to today's Perfect Practice Alliance webinar, Introduction to QIS Inform, powered by Eagle Dream Health, Clinical Analytics Made Easy. Today's webinar is brought to you by EHR Integration Services and Perfect Practice Alliance partner, Eagle Dream Health. I am your moderator, Nancy Roberts, and we're going to begin with a look at today's agenda. We're going to start with a brief introduction to both EHR Integration Services and to Eagle Dream Health. Then we're going to show you how you can participate in our webinar with your questions, and we will then dive right into our very important topic as I interview Jamie Steck, Business Development Manager for EHR Integration, about some exciting changes coming for users of QIS. And then we will turn things over to Leslie Zeck, Operations EHR Manager at North Ohio Heart, who will share with us some examples of how North Ohio has realized great improvements in the quality of care due to its implementation of QIS together with Eagle Dream Health's Inform product. And finally, we will take your questions if you have any remaining at the end of today's presentation. Now, speaking of questions, we want to be sure that you have as many of your questions answered as possible. So just take a moment and locate this questions box here in your control panel. You can simply type them in here and we will either answer them immediately or during the Q&A segment at the close of today's webinar. Now, this webinar is one of an ongoing series as a service of the Perfect Practice Alliance, a collaborative group of healthcare professionals comprised of physicians, IT experts, and industry-savvy consultants. The PPA was founded by 3 charter member organizations: EHR Integration Services, Bite-Sized Solutions, and National Physician Services. The charter members set the strategic direction for the Alliance. Each member brings a complementary set of health information technology products and services to the organization, along with expert consultants and staff. Now, as noted, today's webinar is brought to you by EHR Integration Services, an organization committed to defining the future of healthcare through a human approach to technology by providing the healthcare information technology tools and services providers need to offer to get the best quality of care for their patients. Today's webinar is also brought to you by Eagle Dream Health, a Perfect Practice Alliance partner organization dedicated to providing data that heals, empowers, and transforms. Eagle Dream Health's mission is to harness the power of analytics to provide your organization with useful and timely patient population analytics, enabling you to positively impact patient lives. If you're here with us today, we know that you're likely using EHRQIS, an EHR Integration Services point-of-care add-on for Allscripts TouchWorks clients that helps simplify the monitoring of quality metrics through a clear, streamlined interface. Or perhaps you've heard of the product from another client and you're interested in learning more. Through our partnership with Eagle Dream Health, EHR now offers an exciting opportunity to take point-of-care quality monitoring to a whole new level with Eagle Dream's Inform module. Inform capitalizes on the power of clinical population analytics to efficiently identify and assess gaps in care based on predetermined institutional clinical guidelines or required clinical metrics so that you can provide superior patient care, all at lower costs. So now let me introduce to you Jamie Steck, Business Development Manager for EHR Integration. Jamie, welcome, and let's get right down to the primary reason for our webinar today. Exciting enhancements are coming for users of QIS. Can you give us a high-level view of what they are and what they mean for QIS users?
Great. I certainly will. Thanks, Nancy. And again, welcome, everyone. We are so glad you're here today and you take a few minutes with us to understand what those changes for QIS mean. But we are planning some changes, and what we are working with is our partner at Eagle Dream Health, and we are excited to work with them to embed the QIS tool inside of the population health program. This is the direction that we feel like is going to give the caregivers the best decision-making tools at that time of the appointment in order to care the best for the patient and to close those loops that exist for the patient. To have all of the reporting power behind QIS was the tool or the piece that we felt we were missing as long as we've had QIS here at EHR, and really put some power behind it in order to close those loops and be able to see what's going on, because again, giving the providers the point of care information that they need can allow them to make great decisions as they move forward. So those are the changes that we have coming, Nancy.
Sounds
and
exciting.
We'll talk a little bit more about it here.
Well, why did EHR feel that these changes were needed and timely?
No, I think today's healthcare system is shifting to focus on population health and using and driving analytics to better healthcare itself. I've heard it said in many different places that reporting and dashboards are just pretty colors and wheels without the ability to take action on the data. And I feel and we feel that that is so true. And so our partners at Eagle Dream also agreed with this in saying if we could marry something together and bring that point of care tool to take the necessary action on it, regardless of the EMR that you're on, what a powerful tool that this could be. And so this is why we are taking those steps.
Well, of course, the next question is critical, I'm sure, to everyone listening. When can we expect to see these changes, and what steps can providers take to prepare for the product transformation?
That's a great question, and we are well underway, Nancy, with that development as we have been now for a few months. We are trying to marry two fully mature products together, and it's going to take some time. Our original thought was that we'd have this ready by ACE next month. That's not going to be the case. It's going to be a little bit later. We're looking probably late September, early October for our general release of this particular product. Right now, there's nothing to prepare for. It's just going to continue to work as it is in your current environment. I will let you know, and Leslie from North Ohio Heart will inform us, as they are a current QIS client as well, that the application QIS will continue to work in parallel with the Eagle Dream Inform product as we then wait to bring on QIS Inform and integrate that particular product. So nothing for the providers to do at this point, or the caregivers. They'll both work in parallel if you decide to, again, to move forward with this and prepare for our new product coming in September, October.
Okay, so either way, you're in good shape. Continue doing what you're doing, or you could even take the first step by integrating the new product and then take it from there when the integrated product is ready. So
that is correct, Nancy. Yep.
One final question. Give us some insight into the benefits of this new QIS Inform product.
Well, you know, I think as I've seen the Eagle Dream, and I know many of our attendees today have seen the power of analytics and how it can change life. I think that's the beauty of what Leslie's going to show us here, is what are those benefits and what can you do. And I say the power of information is extremely powerful and positive in this aspect. And so if you could change something at the point of care or do something for a patient that you really never had the ability to do before, and see and manage the stoplight like you do now, but knowing that all of the information is behind it, or to order maybe, let's say, an A1C for a couple hundred patients that you wanted to close the loop on. Those are the types of things that we're going to have inside the application now. So I just think the sky's the limit. You're going to see a lot of benefits, and I think Leslie's going to show you what some of those benefits are, but would certainly be glad to take questions or specifics at the end of the webinar. So I'm excited.
Okay, very good, and thank you, Jamie. Now I'm going to introduce, as promised, someone who can tell us firsthand about this new, more robust approach to patient care management and population data, and how one organization uses, I should say, QIS together with Inform to close those gaps in patient care at their practice, and about the time and cost efficiencies that they've achieved in just a short period of time. With us now is Leslie Zach, Operations and EHR Manager at North Ohio Heart. Leslie, can you start by giving us a bit of background on North Ohio and your role in the organization?
Thank you very much for the introduction, and I'm excited to take the opportunity to explain to everyone some actual software that we feel has helped move our practice forward, has helped put the pieces together between data and quality and patient care. And so we are actually a group of originally cardiologists that was founded in 1976 by Dr. John Schaefer. We just had a anniversary a couple of weeks ago. We are now a 46-physician practice that has both cardiology, primary care, and internal medicine. Several years ago, we had the opportunity to join a group or have a group of family practice, primary care doctors join us, and it's been a great partnership with them. We have 8 office locations, about 172 staff, and 5 IT FTEs. That includes Mindy Price and myself, who are really responsible for all things quality, EHR, meaningful use, etc. So we started using Eagle Dream we started using QIS in 2014. We were looking for something other than the actual clinical alerts. It was too much data and too many things for the physicians to remember to try to think of, okay, when I'm seeing this patient, I need to focus on these metrics. And when I'm seeing this patient, I need to focus on this. And the providers were overwhelmed. The staff was very overwhelmed and frustrated. And we had come across the QIS product. We've used EHR previously for the chart to PDF. And so we were able, with EHR integrations, to look at their QIS program. And unfortunately, we had to wait until we could put it into the budget for the following year. But we were really excited, and it allowed us to build the QIS metrics based on age, gender, and diagnosis. At the same time we were doing this, we were looking to implement our charge module. So the physicians were being pushed to pay attention to ICD-9 codes in the EHR and diagnoses in the EHR and clean that up. So the timing of that really made very good stepping stones for charge, diagnosis, and then QIS to jump, springboard off of those more accurate diagnoses in the EHR. Once we did that, we started pulling reports and data and looking towards quality metrics, and you had to look at all of the quality pieces to report for your CQMs for meaningful use. And everybody was talking about quality. And what we found early on was we didn't really have a good, robust system to measure that quality. And if we wanted it to be measured through our EHR, it had to be linked to very cumbersome, very labor-intensive, click-intensive workflows. And that was difficult to roll out to physicians and say, for example, a mammogram, you didn't order it because we have GYNs that sometimes see those patients, but we have the scanned result in, but you have to do this 20-click workflow to count the scanned mammogram and to get good data into your metrics. And with, the constraints of being able to measure the data and measure it accurately, if they didn't do the workflow, they didn't get the credit. So it was a very frustrating position that we were in. And at that point, we had the opportunity, I believe it was someone from Eagle Dream mentioned to us, or from QIS EHR integrations, that they had this product that we should look at, Eagle Dream. And so we looked at it, and it was a phenomenal product, and the people there were great to work with. They were excited. So we took an early leap into working with them, and it has more than been paid for itself. It has been a great experience. We've been able to move things forward. So what I'd like to do is take just a minute and show you, without breaching all of the HIPAA rules that we all love so much, what I can show you about the practice and about some of the reports that you can get from Eagle Dream and how that's helped move us forward. We've had some computer difficulties, but we will try to allow me to show you what I can, and then I'll go over exactly how we've used those reports to manage the 5 metrics that are on your screen. We took a huge leap with our physicians, and it was kind of that put your money where your mouth is type of protocol, and the physicians actually have a withhold amount of their comp that is held for quality. And in order to get that money, quote, back, it's not really a bonus because it's really taken out of their baseline pay. In order to get it back, they have to perform on these metrics. So obviously, you know, when you've got physicians' money in your hand, the data has to be right. We were held to a very high standard and scrutinized to the nth degree on the data. So we were really happy when we could move to Eagle Dream, get reports that were actionable, that we could work on, and that we could validate the data and work with a partner that was very receptive to what our issues were and how to help us manage them. So at this time, I will go ahead and take the controls and try to show you what I can off of Eagle Dream.
Okay. And as noted, we were having a little bit of difficulty linking up, but it looks like it's working just fine.
Okay, and can you now see my Eagle Dream screen?
We can indeed.
So what you'll see on the Inform is you will see the ability to create different populations. You basically can choose and start your own initiatives, and in those initiatives, you can choose what you want. So we have a list of initiatives. We're part of an ACO. We are affiliated with the university. Our physicians are actually employed by University Hospital Systems of Cleveland. So they're part of the ACO. So we have an ACO initiative that will allow us, because we've tagged our patients as ACOs through their insurance, we can look at just the patients that are in the ACO. We can look at our physicians that have a quality incentive for cardiology and a quality incentive for primary care. And with the introduction of Eagle Dream, we've been able to look at different metrics for cardiology and for primary care. The first year was very difficult and very challenging, and so we committed to only looking at metrics that were really cross both populations. So we looked at things like the tobacco use, the hypertension, the BMI, the pneumovax, things that were really relative to both divisions. And this year has allowed us to look at things that are more specific to one versus the other. So we've got different metrics. We retained all of those metrics, and then we added a couple cardiology-only metrics and a couple primary care-only metrics. And this allows you to look at that. Another interesting piece is just looking at your patient population. I can sort this by all the specialties. I can look at it just by practices, and I can look at it just by providers. So we all know that practice A always has the oldest, sickest patients compared to practice B. So I can actually do a compare of one office and compare it to another office. And I can show them that, look, your age is the same. Your average, your female population is the same. I can show them that, you know, their insurance breakdown is relatively the same, so they don't have the most indigent population. Or we do have a couple offices, you know, we have one office that really does, and this validated that what our billing office was finding, we were able to validate out through Eagle Dream as well. So this is a really nice ability to compare patient populations. I can look at age. You can look at specific offices. You know, here's the age curve for 2 of our bigger cardiology offices, and it really isn't that different. You know, a couple percentage points here and there, but overall it's not. I definitely have the oldest patient population. So I was able to put some of those myths to rest as we looked at that as well. We can also look at the metrics, and this is where it gets very interesting. Get the compare off. We can look at all the initiatives. Like I said, I can look at just the ACO, or I can look at what cardiology or primary care is focusing on. So when we look at this, I can look at all practices, and it's a really easy visual to look at. We have set all of our performance rates to 90%. So anything less than 90%, if the physicians make 90% on any metric, they get 100% of their money that was set aside back. After that, it's set at 80, 70, and 60%, so they get a portion of it back. As you know, this is the breast cancer screening that we were talking about because it was based on scanned documents. So we're working on this now. We're getting the scanned documents and linking them through QIS, and then they're being picked up by EagleDream. We look at controlling high blood pressure. I can click on here, and unfortunately if I click on it, it will give me an actual report that would have patient names in it, which I am not able to do. But this would give me a list of all the patients that are not in the goal, not meeting the numerator. This has been a phenomenal tool for us because we can go back, and once you click that not in numerator, it will allow you to choose specific fields that you want included, and this is where the value of this product just grows exponentially. We can go back to the slides now. So if you look at slide 20, you've got report settings, and this is where it gets really valuable. You've got some very basic things that are checked that are patient demographic information, but then you can choose additional things that you want, such as down at the bottom, last appointment, or you can choose at the top, number 4 is the result. So when you choose those, you're able to then pull a report, and if you click to slide 21, you'll be able to see the patient's name, their date of birth, their MRN number, and for this specific metric, which is the hypertension metric, I can see the blood pressure. So I can see for this specific example that I pulled that, you know, some of the blood pressures are very close to the 140/90 for that metric. The physicians may choose to do nothing on that metric. But if I look at column E, I can make this report actionable, and I can sort by anything I want. So I can sort by the result, and I can find out the patients that have the highest blood pressures. And then I also pulled into this report the next appointment. So for the next appointment, which patients don't have a pending appointment? And those are the ones, the lines with the blanks, lines 1, 5, 6, 7. Those patients are not coming in again in the 2016 year. And then if you look down at line 26, that patient is not coming in until 2017. So we have no further opportunity to manage that patient's blood pressure. And in some instances, the physician may choose to do that. He may choose to leave a patient with a blood pressure of 132/98 or 132/94. But he may choose to bring that patient back the 130/100 that's not coming until 2017. But now I have a really actionable report that I can give to the physician. So when we look at these, you know, we were looking at the patient, the blood pressure metric. It allows us to pull a timely report. I can look at patients that are not in the numerator. I can look at the blood pressure that's actually listed because it's resulted in my report. I can see if they have a pending office visit. I have information there that I can pull into the report. I can pull in mailing addresses. I could create a letter to mail. I can give this list to the front desk secretaries and say, please call these patients and get them scheduled to come back for a minimal blood pressure check. So once you give this to your physicians, it's a little eye-opening, and they realize that you have something to give them that you can actually act on and move forward with. The fact that we can pull this anytime instead of waiting for things to update, waiting for ETLs to run, etc., has made it that much more valuable as well. So if we go on to slide 22, we looked at the pneumonia vaccine, and that one we felt was a metric across all practices. So when we looked at that, it's looking at patients over 65. Again, we were able to pull a very timely report. We could pull the patients that were not in the numerator, those patients who have never had the pneumovax. We could look at their name, date of birth, MRN, their mailing address, again, sort by pending appointment. And what we did here was we created a letter in Allscripts, and we're able to push that letter out as the portal message. Hey, you didn't get any more vax, you know, the CDC recommends it. We gave them some specific details on statistics, and, you know, please call our office to set up an appointment to have this done, or you're welcome to get it at your local pharmacy. If you get it there, please make sure to let us know so we can update your chart. So again, we were able to pull this. We can sort it by office. We can sort it by provider. Each office can take their own provider, or you can make this a centralized initiative and, you know, give your quality group or your clinicians or, you know, whoever you choose to work on this independently. So again, it was a very actionable item. It was very easy to partner with the letters within Allscripts and then get those out to the patient. And then the next metric that we looked at was, again, one that is primary care focused. It's the diabetes, the hemoglobin A1C. And we looked at, this is the one with the patients who have a hemoglobin A1C greater than 9. We were able to pull the reports. Again, an easily actionable report. It actually will list in the results the hemoglobin A1C. It will leave it blank if there's no hemoglobin A1C done. It will give us the next pending office visit date. Again, you can sort by pending appointments. You can see which patients are coming up for an appointment and get the hemoglobin A1C done prior to that appointment. The physicians were really excited about this because how often do they see a patient, tell the patient to go get it, and then 2 weeks later or 2 months later, that result comes in, and now they're dealing with the same patient. We're playing phone tag, calling back and forth to give them orders. So we're able to pull this report ahead of time, look at it, call the patient, say, you know, you're going to see Dr. Smith in a week. Please make sure you get this hemoglobin A1C done. I can fax the lab requisition to the lab of your choice, and the results are there to be acted on when the patient actually sees the physician. It's better care. It's more efficient for our staff and our patients and our physicians, and it's also helping meet the metrics. So the tool has been so valuable to us. And this metric specifically was really eye-opening to some of our physicians because they see the patients, they treat them when they're in front of them, they believe they're doing a great job, goes by, and they don't realize that time has gone by and it's been 9 months since the patient had a last hemoglobin A1C, and at that time it was 11. So this gave us a really easy way to pull reports monthly, look at those patients coming up, focus on them, and get them in for the lab work and better care overall, help them manage their diabetes better. The next metrics that we looked at was the colorectal cancer screening metric. And that one is one on slide 24. That one has been, again, like the breast cancer one we struggle with because you don't do the colonoscopies in your office. It's difficult to get the results to count unless it's a labor-intensive, click-heavy workflow. So having QIS, we were able to scan those under their own heading, and because it was under their own heading, it allowed you to count it towards the metric. Because it was counting correctly there, it's very easy for EagleDream to pull it into the data. So again, the same thing. We were able to pull pending office visits. We were able to pull patients that aren't coming back. We can send them letters. We can call them. Again, you're sending the messages through the portal. So a lot of these are the same types of actions, but prior to having this, we really didn't have a great plan. You know, it was getting data. It was very much reacting to the data rather than getting ahead of it and trying to get these patients in or trying to get messages to them. One of the important things to know, though, is when you're using the scanned documents with EagleDream and QIS, is you definitely have to have a discrete naming convention to allow it to pull in with the colonoscopies, with mammograms, the flexible SIGs. A lot of them we had just RAD as generic headers or procedures or diagnostic testing. Those we specifically pulled out so that we were able to discretely count that into the metric. The next metric that we looked at too was breast cancer screening. And again, it follows along very much with the colorectal screening. Women who are 50 to 75, Again, it allowed the use of scanned documents using the discrete naming convention, ability to pull the timely reports. We could, again, sort by the pending appointments, mail them letters. All of these allowed us to focus on the data and allowed us to improve patient care. Because when I was talking to physicians, they all agreed that the metrics were valid, that yes, the patients should have mammograms, or yes, the hemoglobin A1Cs should be less than 9, or yes, the blood pressure should be less than 140-ish over 90-ish. We struggled a little bit there. But they all agreed that that was good medicine. But until now, we didn't have a way to actually make it actionable reports that would allow them to help improve the care to the patient. So when I look at the overall value of the Eagle Dream and the EHR integration QIS product, they're both very easy to use. They're very able to be customized for your EHR processes. Each of our offices do things a little differently. So you can go ahead to slide 26. This allowed the offices to focus specifically on what was important to them at their moment, because they could run the reports when they wanted. This month they may want to focus on pneumonia. The next month this office may want to focus on hemoglobin A1C. They could focus on just physicians that needed, whose practices were falling below the rest of the companies in regards to the data. So it allowed us to customize it both for the EHR and then also by the offices. The reports that I've shown you are very actionable. You can do something with them. The hypertension report that we started off looking at, when in 2014, I sat down with a physician and went over his not in numerator. And I literally had to go through every chart of every patient that was not in the numerator and put the blood pressure on an Excel spreadsheet and sat down and showed him. And I highlighted all the ones that were over 150, and then over 160, and then over 170. And it was a very labor-intensive process. This I can do in a matter of a few clicks and a couple minutes by being able to customize the report to what doctor I want, what results I want pulled in, or what specific report I want at all. It definitely allows us the flexibility of comparison. We have a physician group quality committee, and they're always interested in knowing how are all the offices doing. Is there one office that we have a problem with? Where do we need to focus our work in improving? And this allows us the flexibility of comparing very easily. And then the real-time data of the reports. The data is always updated at night. So when we go to pull reports the next morning, we're not waiting for ETLs. If we find something wrong, Eagle Dream has been incredibly responsive in looking at the data with us, figuring out, is it something that we did that we don't have built right, or is it not pulling correctly? And if it's not pulling correctly, they've been incredibly timely in having that fix in and getting back to us, letting us know, look, this is in, test it, tell us if you agree or not. They've been just wonderful to work with. So we overall have been very pleased with the ability to move forward. The doctors are now buying into that the data is accurate. The supervisors are excited to have things that are actionable that they can work with, and this year has gone so much better than past years with regards to our quality programs.
Wow, well, thank you so much, Leslie. That's a lot of great information, but as always, there will probably be more questions and answers, and in fact, we've got a couple coming in, but we do thank you for your insight into your experience with what sounds like an absolutely huge leap forward in patient care management. Now, as we noted before, you can ask questions by locating the Questions tab in your control panel. Type your question in there. And actually, I've got a couple of them already, so I'm just going to jump right in and ask. With adding Inform to an existing QIS implementation, how much additional mapping of results is required or was required, if any? And I think either Jamie or Leslie could take that one. Maybe Leslie, you want to give us your experience?
Yep. Sure, I'm willing to take that. Very little. If there were pieces that you realized that you didn't have mapped, the staff has done a great job. They had embraced the QIS program initially, And then when we started focusing more on the metrics, they kind of fell off of that a little bit. And when we pushed it back out this year with the new metrics, we really focused on, look, if you guys work QIS, this stuff is in there. It's easiest to put the result in QIS. It's easiest to put the lab in if it didn't come in through the interface. And so they really started looking at QIS, and we did find when they started looking that there was, we have had, actually we were one of Allscripts' initial clients back in the beta CMS 1.0 years. So we have had Allscripts for 20 years, which brings a lot of baggage along with it because it is an evolutionary product. You know, things like compendiums and the ability to do the parent-child relationship for lab results and interfaces has grown substantially over those years. We have a lot of dictionaries that had to be specifically built when we brought interfaces up for our hospitals. And so we found creatinines that weren't linked because one was a creatinine, one was a CR, and we had to go back and put those in. But overall, there wasn't a lot of additional builds. We had to build out, you know, users and the admin pieces, your offices. The initiatives were pretty much built by Eagle Dream based on the QIS and the NQFs, but overall it really wasn't much. Like I said, we had done some things correctly, fortunately, like having a scanned mammogram header, having a scanned colonoscopy. So if you don't have those things built out discreetly, those you will have to go back out and build and then kind of play catch up getting that stuff into the system under the discrete headings.
Okay, another question here. Do providers in a given practice have limited access to reports of other practices? How did you decide who can see which reports, and if they can see reports from other practices? And you did mention that there were comparison views. Is the drill down capability disabled so they don't see patient level information?
So practices do that a lot of different ways. We are actually one large group practice. We are all under the same tin, and we started even with meaningful use as having an open access policy. Our quality committees have representation from each office, so every office has at least one or two physicians on the quality committee and on the executive committee. So we really have open access. Our physicians, interestingly enough, are not so much interested in going to the dashboards or going to the data. I take that to them in the quality committee meetings and present it to them, but as far as them going in and getting it themselves, we would give them access. They're really not interested. Our office supervisors have access to their own offices, so they can see their own office. I don't believe that we have given them access to see each other's office, but any of the physicians, the CEOs, the quality would be able to have open access to everybody if they were interested. But again, that interest has been low. When we publish reports with all the physicians' names and how they're doing on each metric, so it's obvious to everybody. You know, there were some mixed feelings about that. One side is, you know, competition is good, and, you know, it has helped move some of the stragglers forward. It has also allowed us to look at, you know, discrete offices by, okay, these three physicians practice there, and none of them are doing well in this metric, and, you know, another office would, you know, there's the dialogue between, well, how are you guys doing this so well, and we're not. Mm-hmm. And so that's been some great dialogue at the quality committee table between physicians on, you know, why and how.
So Jamie, maybe pick up on that. Is that configurable by practice?
It absolutely is. It's all role-based security based on the level that you want them to see. So exactly as Leslie was stating, it's all role-based. If you want to shut it down per practice, and the higher you go up, the more access you have, that's all configurable and set up by the Eagle Dream team. So great question, but yep, absolutely in your control.
Although it does sound like it can be presented as an opportunity as well as
sure can.
Just that
absolutely.
idea.
Yep, it sure can. And so again, I think that's one of the large benefits that you'll see from jumping into that.
Okay,
Leslie,
you go ahead.
yeah, if I can, I'd like to ask Leslie a question. I wanted to see, since you've been on Eagle Dream or QIS or Inform since February, I know it took a little bit to validate your data, but I want to know, have you seen, as you tackled some of these metrics, have you seen progress from what you showed us? Have you seen improvements in like the pneumovax or the breast cancer screenings? Has the providers changed their processes? Does that make sense?
Mm-hmm. And yes, absolutely. So I'll take the pneumovax for one. Because we're now able to get this information out to them, and we try to get them out a summary report monthly, they started looking at specifically the pneumovax, and it was interesting. The cardiology offices that are near or in a what we call combined office where we have primary care and cardiology, those had higher patients compliance with the pneumovax. So our cardiology offices, our pure cardiology offices, actually chose to start giving the pneumovax on site. So they are now giving it, and we have one cardiology office that has not given it on site. They're giving it, but they're not giving it at the time of service. They're having the patient schedule an appointment and come back for it. And it's interesting because the other two offices, their data, their pneumovax numbers are going up, and the other one is relatively stagnant because the patients aren't coming back. They may schedule that appointment, but we're finding them that they either no-show or that they cancel it. The one cardiologist at the quality committee table said to a couple of the other ones, I tell every one of my patients, you need to have this. You know, this is important for you because you have cardiology issues. If you get pneumonia, you're going to be sicker than your wife sitting there who doesn't have any heart problems. So you need to get this. And he said he's never had a patient turn him down yet. And, you know, a year ago, he wasn't even talking to a patient about a pneumovax.
Wow. So not only opportunities for the physicians themselves, but for really seriously better patient care.
Absolutely. I think between the pneumonia and the hypertension and the hemoglobin A1C, we're definitely seeing improved patient care.
Now, I think you addressed this one, but just to make double sure we got this answer, how often is the data refreshed, or is that dependent on how you set that up? I don't know. Jamie, is that a question for you?
I think Leslie could start that.
Okay,
sure.
It is refreshed nightly, so anything that you put in, it can also be refreshed immediately. So if I put into QIS a pneumonia vaccine because the patient had it done at a drugstore, I can hit refresh patient and it's going to pull that over immediately. So you can refresh it, you know, everything refreshes at night, but you can also demand refresh so that then when the physician walks in the room, if he is looking at QIS, it's in there and it's correct.
Okay. How long does it take to make changes to the metrics? You're saying that's instantaneous, or?
If you're making changes to the logic of the metrics, that will take Eagle Dream some time. But basically, the metrics are the metrics are the metrics. So, you know, Eagle Dream has had great experience with pretty much all these metrics anyway. It's more on if you're making a change in your like mappings. Occasionally, they'll have to re-pull the data, and that may take a day or two, but never, you know, normally not longer than that. So we found a couple issues with, you know, things that we had mapped wrong. We had it pulling a VLDL instead of an LDL. We had to unmap that, have the data repulled, and literally in a couple days you had everything back and you were testing and looking at it again.
And it's safe to say that the physicians use this in their daily practices now?
Yes. So we have our clinical staff that rooms the patient usually goes through QIS when they room you, and they're asking you, Leslie, have you had a colonoscopy? When was your last mammogram? I don't have a pneumovax for you. Have you ever had it? So they really go through the QIS, and because it is age, gender, and diagnosis based, they're not asking a male patient or having to think, okay, this patient's a male, I don't have to ask about a mammogram, or this patient's not 65 yet, so I don't have to ask about the pneumo. It's right there for them. And the blending between the QIS and then the Eagle Dream to pull the reports has allowed the staff to get much more efficient at rooming those patients and staying on top of what's important for each patient, because it is, very patient specific.
Sounds like it's been a great success for your organization.
It has been. It is very easy to talk about something that's actually made a difference, been a great project to work with, and have a great team between QIS and Eagle Dream. Normally, things from the IS department, we all know we're giving staff and physicians and end users things that here's one more click, or and this hasn't been that. And once I was able to pair it with giving the supervisors actionable reports, they took off with it. It was almost hard. We had to really think about how to rein in and what we wanted to focus on, because it was a little overwhelming in the beginning because there was so many things that you could do with this. And so we really chose and put a concerted effort into just sticking with, these are the metrics we're working on right now. Yes, Dr. X, we could do this or we could do that, but right now we're going to focus on this until this is good, and then we'll look at some additional things you guys want this fall.
Great. Thank you, Leslie. Jamie, you had a couple comments to make for a wrap-up here.
I do, and again, I appreciate everybody taking time to be on the call. It's truly been a fascinating story as we watch the transformation of healthcare and being able to see and have access of this information. We're just so glad to have our partnership with Eagle Dream and the changes that we're making here. So I know as we come up on our ACE experience here, most of you are coming. I just wanted to say stop by our booth. We're in booth 913 and talk to us about Eagle Dream if you have some questions. Dr. Betty Rabinowitz and Dr. Danny will be there along with Scott Gucciardi and being able to sit with you one-on-one and have that discussion time for a deeper dive into the analytics or the capabilities of this product. So we encourage you to stop by, play our games that we have in our booth, have a good time, but also come and get what you needed to as well and meet the people that can help you do this. So I think looks like there's one more question.
There is one more question. It's a perfect.
Nancy, if you want to address that, you bet.
It seems like a perfect wrap-up question here, actually. This one says, one thing that we've noticed with the implementation of QIS has been the increased engagement with the EHR of our providers. They seem more interested in the data. And is that your experience too, Leslie?
Our physicians, yes. The short answer would be yes. We got them engaged when we put in charge, and that made them start really looking at their diagnoses for the first time. And then when we layered QIS very shortly after that on top of it, the difficult part was they wanted the stoplight to be green. They're very into wanting, and because we're a combined practice, we had originally built out the metrics so that the primary carers would see these metrics, cardiology would see these metrics, and it got very difficult. And then it was difficult to manage from an IS perspective, and then with the ACO, if that patient was attributed to you, whether you were cardiology or primary care, it didn't matter. Cardiology was now responsible to find out if the patient had a mammogram or hemoglobin A1C, or didn't have to order it, didn't have to manage it, but somehow we had to know. So we wiped all that out and just made it all one QIS so that they're all seeing all the same preventative things, they're seeing all the same metrics, but they're not getting the green light. So they got very engaged in it, and they still are, but the negative piece is they don't ever get the green light. So,
well, that's great. We thank you very much, Leslie, for all of that information, and thank you all for being with us as well today and spending some time with us. We hope that it's been useful time. If you have any further questions or you want to set up an exploratory call or a demo, please contact Jamie Steck at either the number or the email that you see there on your screen. And we thank you again very much for being with us, and we hope that you all have a great afternoon.